Hello, my name is Brandon Daniel. It is 12/16/18. This is my audio recordings for therapeutic communication/history. I get a call for a 62-year-old male having chest pains. When I arrive on scene, I take the proper precautions to make sure I have my proper BSI PPEs. While walking to the house, I make sure the scene is safe. I look for any type of hazards, such as weapons, electrical, chemical, anything like that. I determine what type of day it is. Is it night? Is it hot? Is it cold? Is it snowing? About that time, I enter the house and I present myself to the patient. My patient is found sitting on the couch, speaking to me when I walk in the door. I say, "Hello, my name is Brandon. I'm here to take care of you today." At that time, I reach my hand out to attempt to shake it to feel a radial pulse. He greets me, says, hello, how are you today? I said, "What's your name? Do you know where you are? Do you know what today is?" He replies with his answers that he is correct of AVPU at person, places, thing, and event. "Are you the one that called us today? Is there anyone else in the house that is sick or hurt?" He says, "No, he is the one that called." I said, "Well, what's going on with you today?" He said, "I woke up this morning having 10 out of 10 chest pain." I said, "Okay, about how long ago?" 2 hours. I said, "Well, do you mind if we go ahead and get some information from you?" He said, "No, that's fine." I said, "Well, could you rate your pain out of a scale from 0 to 10? He says, "Yes, it's a 10. I said, "Well, what were you doing when this pain started?" He said he was just waking up, fixing some breakfast. I asked him if he had any type of pertinent medical history. He said, "No, never had anything before." I asked him if he was allergic to any medication. He said, "Not that he knew of." "Have you ever had any type of problems like this before?" Patient replied with, "No, nothing like this before." I asked him when the last time he had something to eat. He said, "This morning when he had breakfast, that's when the pain started." I said, "Does the pain move anywhere or does it stay in one place?" Patient states it stays in one place. I said, "So about what time did this begin this morning?" He said, "Well, it was about 8 a.m. when I woke up." I said, "Could you describe the pain? Is it a sharp, crushing pain?" He says, "Feels like an elephant sitting on my chest." I said, "Well, if it's okay with you, let's go ahead and get on our cot and let's make our way to the ambulance." Patient stands up, gets on the cot, makes his way, and we brought him to the ambulance. I said, "Do you mind if I take a set of vitals on you?" He says, "No, go ahead." Patient has normal vitals, blood pressure 120/70, heart rate is elevated at 110, and he's having a O2 sat of 100. That time I decided to check a secondary assessment. I'd listen to the patient's lungs, listen for heart sounds, look and see if there's any JVD noted. None noted. I decided since it is chest pain, let's go ahead and do a 12-lead EKG on him. 12-lead EKG shows no ST elevation. Right-sided 12-lead is also applied, still nothing showed. About that time, I decided I was going to make a decision to transport. We're going to go ahead and transport to the closest appropriate facility for cardiac. This time, I'm going to ask the patient if he cares if I go ahead and start an IV on him and get some fluids going. He says yes. I start at 18 gauge in his left AC. About that time, we start rolling. I want to repeat my vitals. About that time, vitals are about the same. Blood pressure 126/84. Heart rate's 113, still 100% room air. Where I have got the IV, I went ahead and checked the patient's glucose. It is 120. I'm going to repeat a secondary assessment and listen to lung sounds, heart sounds, palpitations, see if the pain goes anywhere. Patient says no. I'm going to go ahead and do a verbal report to MedBase en route. And I want to make sure that I keep my patient calm and comfortable, make good eye contact, show interest in patient, make sure that I listen to his questions, and make sure that I get every type of information I can get from him. About that time, we should be arriving at the hospital, and my patient will be transferred over to receiving RN in ER.